Quality Improvement by Jessica DeJesus, Madeline Simic, and Kelsey Kilmer. So what is quality improvement? Quality improvement began in the manufacturing industry in 1950s with W. Edwards and Joseph Warren. The purpose of quality improvement is to meet the needs of patients in a proactive way. So basically you want to try to fix things as problems occur at the moment. So you can do this by possibly while you're working. You can assess the way you're working and identify ways to improve your performance. You can also use scientific data to find ways to improve your performance as well. So basically you want to meet the needs of the patient, use quality performance while working, assess the way you're working and identify ways to improve your performance. Again, you want to use a scientific approach and data to find opportunities for improvement, improve healthcare performance, and change healthcare systems continuously. Next, we have quality assurance. So, prior to 1980, the focus was on quality assurance. Quality assurance is more focused on making sure that they are doing things right. They measure performance by reviewing chart audits and incidence reports. The focus of quality assurance is to make sure that the standards are being met rather than focusing on situations that are currently happening. They're not so much concerned with how staff and patients are doing at the moment, but rather do they meet the standards. The only time one would strive for improvement is when standards are not being met. General principles of quality improvement. So, there are 5 basic principles to quality improvement. The first is the priority to the patients and all other internal and external customers. This means that we should put patients first. We should look at ways to keep patients safe and healthy. The next is quality that is achieved through the participation of everyone in the organization. So what this means is that everyone is responsible for the growth and improvement of the hospital. It is our responsibility as caregivers to consistently try to improve and take responsibility for the success or even the failure of the organization. We need to take an active part in finding new ways to do things. Improvement opportunities are developed by focusing on the work process. A process in the healthcare setting includes the work and activities and the help with the care of patients. So, for example, rehabilitation, prevention, food preparation, patient education, they are all part of the healthcare process. It is how we all work together for the patient. Decisions to change or improve a system are made based on data. This is a way of improving based on the information we gather. For example, if someone says the patients are waiting too long, we can look at data to see how long patients are waiting and try to improve on this. Improvement of quality of service is a continuous process. What is the focus of quality improvement, and why is it important in today's healthcare environment? Quality Improvement Organizations is one of the largest federal programs dedicated to improving healthcare quality at a community level. In the healthcare setting consists of a systematic and continuous approach that leads to measurable improvement in the healthcare services. They focus on patients and data. The reason quality improvement is important in the healthcare setting is because it improves the healthcare service and the healthcare outcomes, as well as patient satisfaction. So again, the focus of quality improvement is better healthcare quality, measurable improvement, focus on data, and improvement in healthcare services.
Implications for patient care. Implications for patient care can be measured by value of care. Value is defined as both quality outcomes and cost. Outcomes are defined by the patient's hospital care provided during their stay or how well they function after the care they received. For example, did the patient live? Is the patient able to go back to performing everyday tasks, such as going back to work? Outcomes are measured depending upon patient satisfaction. For example, would they recommend this facility to family and friends? Cost is broken up into two parts. Direct cost, which is the cost of the care provided to the patient. Examples of direct cost is medications, emergency room equipment, and salaries of the care providers. Indirect costs are costs other than cost used for the direct care provided during the hospital stay. Examples of indirect costs are electricity, salaries of the care providers who do not provide direct care, such as secretaries. An increase in quality of care causes the cost of care to decrease. Ways to increase quality of care. You can do this by using evidence-based practice. Evidence-based practice is the use of current, best evidence in making decisions about care of the patient while integrating clinical expertise with the best clinical evidence obtained from research. Also, standardizing nursing care by initiating clinical pathways for specific diagnosis. Methodologies for quality improvement. Executing methods for quality improvement requires considering the following: the methods used to collect the data, the response to the interpretation of evidence, and the atmosphere of care. Methodologies for quality improvement. Examples of those are the Plan, Do, Study, Act cycle and the focus method. The amount of money it costs a facility to address nosocomial infections, bed ulcers, and medication errors provides incentive to find ways to protect the patient from these complications. The Plan, Do, Study, Act cycle starts with the following questions. What are we trying to accomplish? How will we know that a change is an improvement? And what changes will we make that will result in an improvement? The PDSA cycle. As the three questions are being answered, testing needs to be done simultaneously to evaluate the changes. The purpose of testing is to determine the effect of the change and learn different alternatives. The goal is to increase the ability to predict the consequence of the effect of change if they were put into action. This is a chart showing how the PDSA cycle works. First, you plan a change, test, or activity that needs to be improved. Then you want to carry it out and actually do it. Then you want to study. You want to study the results. What did you learn and what can you predict? And then the act. You either want to adopt the change or start a new one and run it through the cycle again. The next method is the focus method. It provides a step-by-step guide to move through the improvement process. The F stands for focus. You need the focus of the improvement idea. During this step, an improvement idea is stated and data is completed to support the hypothesis that improvement is needed. In this step, you want to ask questions such as, what is the problem? And you want to make sure you have support that your idea has room to improve on. The O stands for organize as a team. You need to identify group members who are direct participants in the work process, and you must identify a team leader. C stands for clarify. You need to clarify what is happening in the work process. A good way to do this is using a diagram. The U stands for understanding the degree of change that needs to be initiated. The team will review what it already knows and learn more by reading or studying data. Benchmarking or other healthcare benchmarking other healthcare facilities could be beneficial. During this step, you want to ask the question, how are other healthcare companies carrying out the process? S stands for solution. You need to determine a solution in order to improve. The team can collaborate and choose the best outcome. The team can then test the solution by using the PDSA cycle. The implementation plan needs to be tracked. This can be done in the form of a work plan or a Gantt chart. This chart helps identify what activity has been completed and who completed it and when it will be completed. It summarizes the steps needed to be completed to implement the change.
When it comes to quality improvement, there are several improvement strategies that can be used. Benchmarking is the continuous efforts of an interdisciplinary team working together to compare and evaluate results of certain work processes. This strategy helps to identify gaps in performance and present other options for improvement. Clinical, financial, and operational benchmarking are subsections of this strategy. Regulatory requirements have been set by the Joint Commission to guide activities carried out by healthcare groups. There are new goals that are put out each year that organizations need to have in place to promote improvements for patient safety. Unfortunately, sentinel events occur and require investigation. A sentinel event is an unexpected circumstance that results in serious injury or death to a patient. The process for investigation of a sentinel event is the SBAR method. This includes situation, background, assessment, recommendation, and response. These investigations need to happen to see what went wrong and how to improve procedures in the future. Measurements are needed to assess and monitor outcomes. Examples of measurement include a balanced scoreboard and a clinical value compass. Certain indicators need to be selected in order to collect data and to interpret it. After these indicators are chosen, the data from these is tracked and checked at regular rates, such as every month. The data is then assessed, evaluated, and changes are made as needed. Storyboards are a way to share the data and work collected with the rest of the team. It outlines the goals and the major points about the progress. Patient satisfaction data is acquired by having the patients complete a survey, by making phone calls, or by holding a focus group after discharge. All of the responses are gathered and put into a database where it can be viewed and compared. There are several charts that can be used to evaluate this data. Time series data lets you see the change in quality over time. Some of the charts that are used include Pareto charts, histograms, flow charts, fishbone diagrams, pie charts, and check sheets, and they are all different ways of showing information and can be helpful in decision making. They display cause and effect of all problems. Using these charts helps to show organizations what areas have improved and what areas still need work. Almost all organizations are set up to maximize quality improvement. Members need to be accountable and communicate clearly about the expected outcomes. The structure needs to be set up in a way that links their mission, the vision they have, and the value of what they are working to accomplish.